Namaste. Today topic is Glasgow coma scale. So what is this Glasgow coma scale and how to measure the GCS scale for the patient? Today we'll discuss about that. The Glasgow coma scale is the most common scoring system used to describe the level of consciousness in a person following a traumatic brain injury. Basically, it is used to help gauge the severity of an acute brain injury. The test is simple, reliable, and correlate well with outcome following severe brain injury. So this GCS scale will be measured to know the conscious level of a patient when patient had a traumatic brain injury. So there is a scale. I'll show you in our next slide. Based on that, the GCS scale has to be measured. In a GCS scale, every brain injury is different, but generally, brain injury is classified as severe, moderate, and mild. If it is a severe, GCS score will be 8 or lesser than 8. If it is a moderate, GCS score will be 9 to 12. If it is a mild, GCS score will be 13 to 15. And this is the scale will be used to measure the GCS. In a GCS scale, the most important parameters are eye opening, verbal response, and motor response. So in eye opening, again how to score whether patient opening spontaneously or not. In eye opening, if the patient opens the eye spontaneously, the score will be 4. If the patient open the eyes for the sound, the score will be 3. If the patient open the eyes for a pressure, the score will be 2. If the patient not open for even for the pressure, sound and spontaneous, the score will be 1. And in a verbal response, if patient oriented, in the sense if he responds for our commands, the score will be 5. If a patient is in a confused, if he has something, he says something, the score will be 4. And if a patient speaks words inappropriately, so the score will be 3. And if the patient makes some sound, abnormal sound, the score will be 2. If there is nothing, the score will be 1. And in a motor response, if the patient obeys commands, the score will be 6. If patient responding for localizing pain, the score will be 5. If a patient having a normal flexion, the score will be 4. If the patient having abnormal flexion, the score will be 3. If the patient having extension, the score will be 2. If nothing is there above mentioned, the score will be 1. So this is the eye opening, verbal response and motor response from the patient. So again we can divide based on the score mild, moderate and severe. If the patient responds well, it comes under mild. If responds moderately, the score will be 9 to 12, and if there is no response from the patient, the score will be severe and it comes under 3 to 8. So based on that, we should record in a GCS scale, and based on that action should be taken.